Welcome to another edition of Nathan Rambles About Things. I was just thinking, as I try to do often, just about some different things that we often say are painful or will definitely require surgery and that it can't be helped. So I want to share a couple different patient stories. I won't use any names or anything like that. I had one client. He was 40s, 50s, and this guy had shoulder surgery before, and he actually had an MRI. He came in prior to seeing me for physical therapy, and in the MRI, it said he had like a moderate tear in the supraspinatus, which is a rotator cuff muscle. And in our country, we have the tendency to, if somebody has a rotator cuff tear, to immediately say, oh, you're going to need surgery. Like physical therapy or exercise or whatever cannot help you. Okay. So it was interesting because he came in right after this large review paper had been published that was actually talking about how this procedure called a subacromial decompression, where they go in and clean out the joint space, not necessarily for a rotator cuff tear, but more so for what's called an impingement. But anyways, he was going to undergo that. He was like, well, do you think I need to go and do this? And I said, well, you could, or we could give it a couple months, work at these different exercises, and see how you do. And this was in line with what they found in the review papers, that people who got the subacromial decompression for impingement or a small tear or whatever, or went through conservative management, so exercise and such, actually had very similar results. And the kicker is that similar results from surgery or conservative management, exercise, etc., the exercise portion didn't have any adverse events. Now, if you undergo surgery, there's chances for infection, there's chances for blood clots, a lot of different things. So the complication rate on the surgical side was pretty dang high. So we're actually seeing a lot more studies come out. We definitely need more to further justify this position, but we're seeing more and more studies, especially for like meniscal tears in the knee, for rotator cuff tears, for I think osteoarthritis of the knee, for like total knee replacements and such. What else? Oh, for spinal fusions. We're seeing that when you compare all these surgeries to a placebo, they're not as good as we once thought. They're just, man, there's not a lot of research supporting these various surgeries. Now, what this doesn't mean is that people never need a surgical procedure. There are certainly candidates who will benefit from having surgery, and that's great. Like, we need people who can perform surgeries and help these people. But the problem becomes when everyone's getting these procedures. Like, everyone's getting the meniscectomies, the taking out a portion of the menisci of the knee. Like, honestly, like, so many people still get those done. And we've now had multiple studies saying that, well, it's not really that much better than placebo, and you can do really well with physical therapy. And when I tell people that, when I let people know that actually, like, we could just do exercise and you wouldn't have to get surgery for your meniscal tear, they're like, but it's torn. I'm like, I know, but we can actually help desensitize the area and get you back to moving. And even though you still have a tear in there, it's not necessarily going to be painful. And that's so, it kind of like throws you for a loop, because we have such a structural based medical system and a structural based thinking process too, because If you look at an image and you see that there's a tear, then clearly that's what's causing your pain. But now we know, actually from our own scientific findings, that that's not necessarily the case, that our pain is much more complex than just, here's the image and there's a tear and now there's pain. It's much more complex than that. Second story I wanted to share, and this video is getting a little long, but the second video is that I had a person come in. She was about 60 or 70, and she had some knee pain, okay? This was a really good example because she had multiple MRIs done, one on her left and one on her right. Now, on her left side, she had pretty significant osteoarthritis and 2 large meniscal tears, okay? On her right side, she had a small meniscal tear. Small, so not just insignificant, right? Which knee hurt more? If you guessed the right knee, you're right. That is the knee that hurt more. And you might be wondering, well, why? Isn't it supposed to hurt more on the side that has more damage? Again, pain is much more complex than we make it out to be. It's not just, this is what the image shows, and now you're going to have pain. Much, 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 much more complex. So go ahead and share this video. Please send me a message, leave a comment below. I'd love to have a discussion about this. Take care.